Patients at the Promis Recovery Centre at Nonnington near Canterbury work with individual counsellors to talk through their problems. Zara has been receiving help for drug abuse and shares her feelings with Laura.
It's quite difficult to hear sort of things you've done to your friends and such, like because of drugs and stuff. It's quite hard, but yeah, it was good to hear. I wanted to hear it.
Yeah, it's very often we're sort of caught up in a sort of little bubble of self when we're using.
Yeah.
And it's quite difficult to hear it. When people tell us their experience of our addiction when we get well, isn't it?
Staff hold regular group sessions where they discuss individual patient responses and the way treatment is progressing. They also analyse the feelings sheets which the patients fill in.
There was a big influx of patients this week, and that has had an effect on the group dynamics, which this morning, having all the group together and bonding them in, you worked particularly with everybody. Everybody got a shot this morning and felt part of, and I think that was very important.
All counsellors have themselves received treatment for various addictions. Laura had an eating disorder, but that's given her insight into what others are going through.
Counsellors will disclose, parts of their lives perhaps in the counselling process that they feel is relevant or helpful for the patient. So I think it is very important that we've all been through this process, that we understand what they're going through, and I think the patients feel more comfortable with addicts in recovery than they would with someone who had no experience or understanding of their problem.
One of the treatments used is eye movement desensitisation, or EMDR. It works on the principle that the feeling part of the brain needs to listen to the thinking part of the brain to help resolve trauma.
EMDR helps by stimulating both sides of the body at the same time, specifically with eye movement, but you could easily do it with sound, or you could do it with touch, or with anything that stimulates alternatively one side of the body and then the other. You get the brain, the thinking side of the brain, is alight at the same time as the feeling side, and you can actually demonstrate that now on brain scans.
These sessions can last up to an hour and a half. The clinic has something like a 70% success record with its patients, but of course not everyone makes it. And that's traumatic for the counsellors and staff here, who build up a very close relationship with those they treat over the weeks and months. And even when the treatment has been successful, they don't talk about cures. It's all about learning to manage and control addictive behaviour.